Hi, we're Team VJJ.
I'm Vaishal.
I'm Jana.
And I'm Jesse.
We are all master's students in the Applied Physiology program at Teachers College, Columbia University.
We're going to talk to you today about exercise and health.
Hi, are you an obese individual or person who's out of shape? If you are and want to get life back on track, visit your physician to discuss possible treatment options. Exercise has been shown to be a beneficial method of treatment for all populations.
You can also visit an exercise physiologist who can run a VO2 max test, which measures your oxygen uptake during exercise. This is what Jesse is performing right now.
Before starting an exercise program, it would be wise and helpful to get a proper risk stratification assessment done from your clinician. Proper risk stratification will allow your ACSM certified trainer to gauge current fitness level, and this will help your trainer to properly prescribe an exercise program. This will allow any prevention of any injuries or cardiovascular events. It will also help the individual who is trying to get better gain better fitness. Using your height and weight can be a good method to measure your BMI.
Measuring your blood pressure is a useful part of the pre-screening process. It will identify if you have hypertension. Relax your arm for me.
In addition to measuring height, weight, resting blood pressure, resting heart rate for 1 minute is another variable in the pre-screening process. The ACSM guidelines should be used to properly prescribe an exercise program. The following guidelines are cardiovascular exercise for 30 minutes a day, 5 times a week at moderate intensity, or 20 minutes of vigorous intensity 3 times a week. An individual should also participate in resistance training 2 to 3 times a week at 8 to 14 repetitions. Your ACSM certified trainer will further customize your program depending on what your goals are and what your clinician suggests. Exercise can take place anywhere. It can be indoors or outdoors. It is important, however, to have proper equipment in your facility. It is also important to have an AED and CPR certified individuals present in your facility in case of acute cardiovascular event. This can be highly prevalent for individuals who are moderate and high risk.
It is important to consider the source when you receive your exercise information. I would recommend that you begin your training with a certified personal trainer. They will be able to ensure that you have a proper prescription for your exercise program. ACE and AFA are a great start. However, the field receives its knowledge from ACSM. The American College of Sports Medicine holds the gold standard for certifications in exercise. Motivation is something that plays a role in adherence and lifestyle adjustments. It's important to consider what motivates you to be healthy. What changes can you make to help facilitate this? Put your gym clothes by your bed, for instance. Maybe you want to buy a cute outfit that's going to motivate you to exercise. Create a really fun and energizing playlist to really get yourself revved up when you're working out. Figure out what works for you. And keep in mind your accomplishments too. So, taking the stairs, for instance, instead of the elevator, spending 10 minutes during the day, just doing a quick exercise, walking up and down the hall, standing up and stretching when you're at your desk all day long. Adequate nutrition is key for establishing a successful program. You want to ensure you maintain energy balance, and even if your goal is weight loss, you need guidance for how much of a deficit you should have. Dropping about 1 pound a week is ideal. Make sure you eat a balanced diet and stay hydrated. Consult with a registered dietitian. We're going to take you and show you some basic places where you can consider making adjustments, such as the cafeteria, what you should order, and a little tip about staying hydrated. So what should you eat to be healthy when you're at a cafeteria? When you come into a cafeteria, there are lots of different options of what food choices that you can actually eat. The healthiest is probably a salad. However, you can also look at a hot bar and choose items such as cooked vegetables or grilled meats. Carrying a water bottle is a helpful way to stay hydrated. You can really take it anywhere and it's easy to fill up no matter what type of water bottle that you choose or water fountain that you choose to use. It also will help eliminate waste, so you're doing something for the environment.
Cardiovascular exercise improves your endurance. Having improved endurance can also make an impact on your quality of life. The improved endurance will help with your activities of daily living, such as walking up flights of steps, folding laundry, cutting the grass, and things of that nature. Furthermore, cardiovascular exercise can improve your heart health by improving cardiac output and improving your stroke. Cardiovascular exercise improves your muscular endurance. Improved endurance will directly impact your quality of life, specifically activities of daily living, such as walking up a flight of stairs or cutting grass. Cardiovascular exercise has also been shown to improve your mood.
Taking the stairs can be a nice way to stay active.
So there are lots of different types of alternative forms of exercise. My personal favorite is Zumba.
In addition to the cardiovascular requirements for the ACSM guidelines, resistance training is another component.
Resistance training has also been proven to have many health benefits, such as improving bone, ligament, and tendon health, and also increasing muscular strength. Resistance exercise has been shown to increase insulin sensitivity, which can also be helpful with combating diabetes.
So you're at work all day and you want to have a little bit of exercise? You can even do dips with your office chair. Or you're watching TV. During a TV break, why don't you do some crunches?
Cuerpo, alegría, Macarena, que tu cuerpo para dar la alegría y cosas buenas. Dala tu cuerpo, alegría, Macarena, Macarena. Dala tu cuerpo, alegría, Macarena, que tu cuerpo para dar la alegría y cosas buenas. Dala tu cuerpo, alegría, Macarena, Macarena.
No, don't do it. I'm a boy.
We're keeping that in.
It's an hypertension.
Action. Sorry.
This will help
With fighting blah blah blah. Blah 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 blah.
If you work with a personal trainer, they will be able... What are you eating right now? It looks like a wrap with turkey and cheese and maybe something else.
No.
All right, so that's pretty healthy. Good job.
Action. Jana, what are you eating?
I'm eating a salad, and it's actually pretty nutritious because I'm getting spinach, which is good for my iron. I used olive oil instead of any balsamic vinegars or heavy dressings, which is a lighter option for salads. And then it's full of vegetables, so cauliflower, mushrooms, zucchini.